Good morning, good morning. Hello, everybody. How are you? Hello. Good morning, good morning. It's good to see everybody. That's fantastic. All right. How's everybody doing today? I hope we're doing well. I always like to kind of check in, take a beat. I've had too much coffee this morning. So I feel like it's funny. My topic today was menopause and palpitations, or we can kind of get some irregular rhythms. You know, even sometimes we just feel like we can feel our heartbeat a little bit more. That's pretty common. So I've had maybe one too many cups of coffee today, so I'm a little hopped up. So I'm going to take a minute to just sort of maybe do some deep breathing and bring down my sympathetic drive and let my parasympathetic system take over, slow down my heart rate. So I'm just going to take a beat just to ratchet it down a little bit. But how's everybody doing? Just as a little check-in, I'd love to hear how your morning is, how your week's been so far. Even one thing you're proud of. What have you done this week that sort of helps you get a little bit closer to the person you're trying to become this year? What are you proud of that you've accomplished, this week that just sort of adds a little thing in that bucket? If anybody feels comfortable sharing, that would be amazing. I know for me, my intention, what I'm sort of putting my effort and my intention in as it relates to my health is really prioritizing strength building. As I get wiser in my years, and really as we all get wiser in our years, muscle mass is wildly important, not just because of menopause and estrogen, but just being able to live a vital life, being able to continue to do all the things we are doing now, having muscular strength, having good sort of balance and proprioception is really important. Even the basics of like joint motion is super important, right? Do we have the same hip flexion, ankle flexion, the climb, the steps? So I'm really putting my intention around muscle building, so that I have the endurance to do the things that I want to do, as I get wiser. I tell my patients all the time that when you retire or, as you get older, if you want to be able to do, whatever the thing is, we have to really stack the deck a little bit more, because there's a natural decline that's going to happen as we age. So we have to almost get more functional in order to accommodate some of that natural decline. So my intention is to sort of stack that deck in my favor. So that's what I'm really, really working on, is trying to build that muscular strength and endurance. So I'm happy, I'm using a tonal system that I have in my basement. I was going to the gym, but my schedule has shifted so much that's becoming a little bit more challenging. So if anybody is, wants to share, I've been consistent with my lifting, which feels amazing. So I'm really, really happy about that, and I'm proud of that. And I don't always take the time to be grateful for efforts that I make. And sometimes I think a lot of people do that too, right? We just sort of get the work done and we don't take a beat to say, wow, you know what, that was good. You did a good thing. So if anybody wants to share what they're proud of, that would be amazing. If not, so the plan again was to talk about palpitations or irregular heartbeat. Good morning. Because it's a common thing that happens in menopause. Because again, awesome. Yeah. Gratitude, good night's sleep. Oh my gosh, sleep. So profound. Yeah, that's great. Yeah. Being grateful for a good night's sleep. Yeah. I actually just recently put together because we talked about sleep pretty early in this series, and I put together kind of like a quick little tips on sleep. So maybe I'll post that after this and people can download that. And happy to kind of weed into sleep. I love to talk about sleep because it's just such a fascinating like physiology, what our body has to go through to get good sleep. It's not just about putting your head on the pillow at the end of the day. And so I love talking about sleep. So I'll post that little tip and you can download that and we can certainly circle back and talk more about sleep. Oh, wow, that's a good one. Sit, right? Thankful ability to stop almost everything and sit quietly. Oh, that is so good while moving through this. It is a stressful time right now. And being able to find that little bit of peace in stillness is sometimes hard, but that is good stuff. Like I was saying earlier, box breathing. I don't know if anybody's familiar with box breathing, but it's this like in for 4, hold for 4, out for 4, hold for 4. And you kind of do that. It actually has been studied and shows really good results in activating your parasympathetic, which is our rest and digest system. So it lowers the heart rate, brings down the blood pressure, takes the stress level down. So box breathing is amazing, right? And being able to sit quiet enough to do that. So that's powerful. Yes, 4 days a week in the gym. That is amazing. Yes, health is a priority. I love it. Love it, love it, love it. That is good stuff right there. 4 days a week. That's legit. High five on that one. Woohoo. That's good. I like it. It's hard sometimes to put ourselves first, right? With everything else going on. So those are really, really good. Awesome. Thank you for being willing to share. So let's talk about the heart. The heart is a muscle, right? So just like any other muscle, it requires, well, maybe I'll back up. The heart is really based on electricity. So it's based on electrolytes moving in and out, and it also has hormonal control. So much the same way as any other muscle, it requires, potassium, and it requires magnesium and calcium. So all those really important micronutrients. So that's why I think just as a foundation, having a really solid nutritional plan is super important just for our health, but then especially as we go through menopause to make sure that we're getting all those really important micronutrients. And then estrogen and progesterone also play a big role in how well our vessels dilate, whether they're going to, constrict or dilate, how well the heart's going to pump. So estrogen, as that declines, we can start to see some changes in that physiology as we've talked about in the past. Estrogen is kind of our checkpoint, right? So it lets us know there isn't a fire. We can kind of relax. So when that starts to go away, then all of a sudden we can see some consequences or some responses in our physiology as a result of not having that checkpoint. Brings on the night sweats or hot flashes where it's just a little bit of temperature change and all of a sudden we feel like, oh my God, it's like 100 degrees worse. So when we lose that, we get a bunch of symptoms. One of them can be palpitations or feeling an irregular heartbeat. Good morning. Got some more of the folks joining us. And it can be, again, a matter of, excuse me, I apologize. Give me 1 second. Oh, this is awesome. We got somebody joining from Uganda. Oh my gosh, that's amazing. Oh, wow. Oh my God, it's John. Holy moly. Sorry, I did a mission to Uganda. Oh my, this is amazing. It's so good to see you. Oh, wow. That makes me so happy. So we start to get palpitations, or we can just sense like, ooh, I feel my heart beating more. Or you can actually feel like a rhythm change, right? It's like too fast. Any sort of thing where the rhythm, the natural sort of lub-dub of the heart is changed is a common consequence of, sometimes aging, but then also, palpitations or as our estrogen declines. Oh, this is so good. Gosh, you guys have just filled my bucket today. Oh man, you guys have really my cup is full. So palpitations, that can happen, right? Irregular heartbeat, you sense it more, or you truly have just more of an awareness. So what do we do about that? One, I want to say that that's common. And as I've said previously, the other thing that is super, super critical is making sure that we're ruling out other reasons for palpitations. So maybe I'll take just a beat to talk about what are the other things to be cognizant of and to make sure that your primary doc is ruling out before we just say this is menopause. So sleep apnea can lead to irregular heartbeat. It can lead to something called atrial fibrillation, or AFib, which is the top part of the heart. So if we think about the heart, there's 2 atria and 2 ventricles. So the atria are on the top and the ventricles are on the bottom. So atrial fibrillation is the tops are not doing a tight contraction. They're almost kind of doing this kind of thing where they're doing it too fast. So it's not filling appropriately, pushing enough blood down to the ventricles. Then the bottom part of your heart contracts and it pushes blood out. So when we've got the top part that's just kind of, going too fast, it's not filling appropriately. So then you have blood that sort of is pooling in there, increases your risk of clotting. And obviously we don't want blood clotting because then it pushes it into the ventricle pushes it out, right? So then that increases your risk of stroke and all these other things. So AFib, atrial fibrillation, is definitely something that we want to be mindful of and make sure that what we sense is not that. So when we are having palpitations, yes, it could be perimenopause or menopause, but we should absolutely be talking to our doc about that. Someone should be putting a stethoscope to your chest and listening. Someone should be getting a good set of vitals, a fantastic history, making sure there aren't other things that could be causing it, and then potentially getting an EKG to make sure that this is not atrial fibrillation. Sleep apnea can cause atrial fibrillation. So again, if we're having trouble sleeping, and we talked about this in the sleep portion when we're doing menopause, if we're having trouble sleeping, we also need to make sure, is it just insomnia? And I shouldn't say just, but is it insomnia? And do we need to, again, do a really good sleep history and really maximize all the levers that we need to pull to get good solid sleep? Or is someone having sleep apnea, and do they need to be evaluated for sleep apnea? And I want to just spend a little time on sleep apnea for a second. So I was at a sort of a business event, and we sort of ended up digressing into sleep apnea. I think the normal sort of habitus, or the normal sort of body type we think about with sleep apnea is, really big neck, someone who might be overweight, who, when you lay down, right, all of that anatomy just sort of falls in the back, right, and it causes an obstructive sort of set of symptoms, and we're not breathing appropriately. We can have what's called apneic spells while we're sleeping, or snoring is one common side effect. So we normally have this look, right? We think, ooh, somebody who's overweight has a really big neck. Wow, that's a telltale sign that they probably have sleep apnea, assuming they have symptoms. But what was interesting in this conversation is we really also have to look at just someone's facial anatomy, right? If you have a really narrow nose or a really small jaw, that can also cause some obstructive symptoms. And you might be really slight, right? Really slender, but because of your anatomy in around the nose and the mouth, if you have a really small jaw, that may cause, the tongue to want to fall in the back, and then compound that with a very narrow nose, which tends to sort of shut if you're trying to breathe through your nose, right? So if you're sleeping, your mouth is closed, so now all your air is coming through your nose, but if your nares are really narrow, when you breathe and they close, you can have sleep apnea. So it's not necessarily just it's got to be overweight and all of that. So we need to sort of broaden our and maybe I'm thinking more for physicians, right, or providers. We need to broaden our sort of curiosity around sleep apnea, and not just think about the body habitus. But for anyone who, if you're waking up and you don't feel refreshed, you feel like, oh my gosh, I am just like not getting enough sleep. And if there's somebody who's in the room with you, are you snoring? Women also don't have the classic symptoms. We will usually actually have more mood disorder related to our sleep apnea, like depression, as opposed to necessarily snoring. So we got to think about that too. It's not just about snoring. And again, if your anatomy is such that really narrow nose, small jaw, and you're slender, you still could have signs of sleep apnea. There's a lot of options right now to get a home study done, and that's usually the first step. You get a home study. If that's diagnostic, you don't need the in-lab study. If that's like, ooh, I'm not sure, and if somebody's really still suspicious, then they do the follow-up, in-lab study. But really a home study is something that, we can get done for people just to rule that out. Because again, untreated sleep apnea can lead to heart palpitations or to AFib. Really is the biggest risk factor for untreated sleep apnea. Good morning. We've got some more folks joining, which is amazing. Oh my gosh. Lots of blessings today. So make sure we're ruling that out. Other causes, alcohol. So alcohol can cause some irregular rhythms in the heart. Long-term alcohol use and excessive alcohol use also can cause some pretty significant consequences to the heart. You can get something called alcoholic cardiomyopathy, super long word, basically just means that the heart is not beating as well as it should. The heart gets a little lazy. So alcohol has some pretty significant downstream consequences, but even just small amounts of drinking can cause irregular rhythms in the heart. So alcohol can be a cause of that as well. So again, getting a good history. How much alcohol are we drinking, if any? Is that predisposing us to anything? And again, somebody needs to be listening to that chest, getting an EKG, making sure we're not missing a rhythm that is concerning. Caffeine certainly can cause those sorts of palpitations. So again, really good history. How much caffeine? Are we using any other stimulants? Sometimes there's stimulants in supplements, right? So somebody is taking a supplement that has some stimulants in it. So really taking a good history, looking at what's in all of the things you're taking, reading all the ingredients, and making sure we're not accidentally taking something in that could be increasing our risk of palpitations. So making sure we're covering all those bases. And then again, is there any family history of heart disease, any family history of irregular rhythms or anything? Gosh, somebody young in your family. Young would be women under 50, men under 60 who have died of a heart attack or had heart attacks really early. Your doc needs to be taking that really good history to make sure there's nothing underlying that we need to be, ferreting out. Also, is anyone having any, in addition to the palpitations, are they having any, what I call like exercise intolerance? Good morning to folks joining in. Any exercise intolerance. So you feel your heart kind of beating fast, but then when you go to exercise, you feel like, gosh, I'm running out of gas. I don't feel like I can get enough air in, right? That's a red flag. That is, stop what you're doing, get straight to your doc, make sure somebody's doing a really good physical, really good history, getting an EKG, those sorts of things. So once we've ruled all of that out, right, and we say, okay, we've backed ourselves into, okay, it's not sleep apnea, not drinking excessive alcohol, and if we are drinking a little bit, then peeling back. We've gone through all your supplements and any medications you're taking, that's not causing it. We're not taking in excessive amounts of caffeine. If we are, peel that back. We've really looked at a really good family history. There's no early heart disease. There's no other lab work we need to be doing to ferret that out. Okay, have we checked the thyroid test on you, right? So having thyroid disease can cause an irregular rhythm or palpitations. So again, making sure somebody's watching the story. You've got a really good primary doc who's saying, okay, do we need to check your thyroid? Look for your TSH and your T4 and T3, make sure those are normal, because those being out of line, hyperthyroidism can cause some palpitations. So once we've ruled all the rest of that out and we say, okay, menopause, well, then we say, okay, what are our options? And one, recognizing that that's what it is, and then helping people navigate through that. Again, estrogen is declining. So from a treatment perspective, it's, how do we want to address that decline in estrogen? Do we want to consider hormone therapy? And then obviously it's all the lifestyle things we just went through. Caffeine, alcohol, what's your nutrition like? Because if we don't have good micronutrients, then we're going to get some irregularities going on. If we have what's called metabolic dysfunction, where what we're eating is creating a lot of inflammation in our body, although another term is called oxidative stress, so we're not clearing away all the waste, our liver is not working well enough to clear away all that waste product, that can start to cause some downstream consequences. So making sure our lifestyle is in order, our nutrition is in order, modify caffeine, modify alcohol, any medications that could be doing it. And then again, do you want to consider hormone therapy for symptom management? And then we've also talked about just the potential, not the potential, but the upstream benefit of hormone therapy, because estrogen is so protective for our heart, for our brain, and our bone. So that's why we see, increased risk of fractures as we get older. We see earlier cognitive decline for folks not on hormone therapy. And then we see a significant increase in heart disease and heart attacks in women as we get into these sort of 40s and 50s and 60s. Again, estrogen is gone or going, and that's a really protective hormone for us. So do we want to consider hormone therapy, not just for symptom management, right? It's not just, I don't want to deal with the symptoms. It's actually treatment, right, for long-term health consequences. So I'm going to take a pause right there. What questions? Again, I talked a lot. So what questions? What are people thinking? Anybody struggling with palpitations or an irregular heartbeat where you get a sense, you can kind of feel it in the chest? I've had a few people reach out, just from a patient perspective, talk to me about it. So I'm just wondering how prevalent it is. For me, caffeine does it for sure. Like my tolerance for caffeine is going down, and caffeine's not great. It's not great for hot flashes. It makes my hot flashes worse. It's not great for sleep. My heart certainly talks to me more when I drink more caffeine. So I've got lots of things that are telling me, Dr. Tomar, you need to pull back on the caffeine. I'm trying. I'm not there yet. I'll say yet. But I definitely need to modify that because my body's talking to me. So I'm the same way, right? What we know is the distance between knowing something is good and when we're actually ready to act on it. Sometimes there's a lot of space in there. So I fully acknowledge that even for myself related to caffeine. Yeah. Okay. All right. So no morning caffeine. Do you find that late afternoon, does that affect your sleep? I'm just curious if that affects your sleep. Some people can tolerate kind of a late afternoon caffeine and it doesn't bother their sleep. Yeah, for me, at least right now, it's just the morning coffee. Okay, that's great. Yeah, that's good. That's good that it's not affecting your sleep, which is fantastic because sleep is, I tell you, sleep in and of itself is a treatment. So like getting good restorative sleep is so critical. So running out of gas in the middle of the day. Yeah, I hear you. We've got a whole other job when we get home, right? We work all day and then we got a whole other job when we get home. Yeah. I'd be curious about your nutrition, like to see if your nutrition is what's causing that slump in the middle of the day. That might be something to look at. Doing a really good. I hear you. Yeah, doing a really good diary on your nutrition, front loading some protein and making sure we're getting, like beans are great for hormone health. Fiber is great, so making sure we're front loading all those nutrients. And if we're doing anything that gives us kind of super ready glucose, so think like refined carbohydrates or any kind of sugars, anything processed, that's like quick sugar for our body. So what happens is when we do that, our pancreas pumps out a ton of insulin to move that sugar out of the system. And then there's a natural, like, okay, huge spike of insulin to accommodate what was a really fast input of ready glucose. And then that insulin drops. And when that insulin drops, we're like, whoa, we feel so tired and exhausted. So then our natural inclination is to reach for something that's going to pick us up, right? Because we've got that huge drop in insulin. So I would do think about what you're eating throughout the day, and is there anything that you may be getting into, late morning, early afternoon, that's spiking your insulin and then causing it to drop. So I've got somebody asking to join, which will put you on video. Do you want to join me on video? I want to make sure that that's what you want to do, which I'm happy to have you join. So just give me some feedback if you want me to add you into the video. Yeah, just let me know. I'm happy to have you join. I don't mind having people join on video with me. So if anybody wants to, okay. All right. Yeah, I don't mind at all. Okay. Yeah. Yeah, so exactly. Just look and see. There might be something sneaking into your nutrition that's causing that big spike of insulin, and then right after that big spike goes away and it drops, then it's like, boom, let's reach for something to pick us up. And for you, it's the coffee, but it's what's going on inside. It's your physiology. So you're not crazy. There's something that's dropping that insulin likely. Okay, I hear you. No worries. Anything else? So it sounds like palpitations it's not a big symptom for anybody, for at least for the group that's on. It doesn't sound like anybody's noticing palpitations or irregular heartbeats or anything like that, which is good. That's great. Okay. Any other questions, whether it's this or other things that have come up? Menopause or sleep or anything like that. During the pandemic. That's a good point. So if we think about when we're sick, right, there is a huge sort of metabolic response to that, right? So in order to mount anti-inflammatories, in order to mount an immune response, that's essentially a huge metabolic burden to the body. And again, if all of our muscle contraction is about electrolytes and hormones, it's this constant things moving in and out of the cells of muscle cells in order to generate contraction. The heart is the same like your bicep, your triceps, every muscle. It's a function of electrolytes moving in and out, as well as hormones adjusting how that cell sort of functions. And then when there's this huge metabolic burden on the body because we're going through this whether we're sick or an inflammatory response, then obviously that'll upset the apple cart, meaning we can get symptoms, palpitations, we can get, headaches, we can get dizziness, we can get a whole host of symptoms as a result of that, cellular sort of that metabolic burden on the heart or the system itself. And then there's the whole thing about like the pandemic was just a hugely stressful time, which means there's a lot of cortisol around during moments of stress. Cortisol is a huge stress hormone. Think fight or flight, right? We're being chased by a bear. Our sympathetic system goes into overdrive, huge amount of cortisol. And then that cortisol can also cause, again, this inflammatory response and change our physiology. That is a huge reason why sometimes people, it's hard to fall asleep because their cortisol is too high. Or if we're waking up super early, it's because your cortisol is spiking super early. So then we got to look at what are we doing before bedtime to make sure that we have enough melatonin coming up and we have enough sort of calories stored so that our body isn't waking up too early because our cortisol is spiking too early. So there's a lot of physiology that'll happen whether we're sick or under extreme stress, which can create some responses in our body. Exercising, change my diet, meditation. Oh, yes. Yes, exactly. You're singing my tune. Yes. It's amazing. They may be the harder things to do, but if we take things back to the basics, are we getting good restful sleep? Are we rinsing our brain of toxins? Are we exercising? Are we eating to support good health, good metabolic function? Yes, meditation. Meditation is basically bringing down that sympathetic drive, lowering cortisol, and then increasing your parasympathetic control, dilates your blood vessels, lowers your heart rate, lowers your blood pressure. So meditation is profound. For me, do you have a true meditation practice? Like, do you carve out time to meditate? As far as I've been able to get is box breathing in the moment. I haven't quite been able to say I'm going to have a true, time for meditation. Does anyone else meditate? Wondering if anyone else out there is meditating. It's great. I mean, there's lots of evidence around meditation. Early morning. Okay. That's awesome. Starting your day like that, I have to imagine that's amazing, right? Just to center ourselves before the chaos of the day starts. That's amazing. That's awesome. I love it. Love it. Love it. Okay. Any other questions for today? I know it's kind of a short one today. Okay. What do people if I can ask, what's of interest, topic-wise in regards to meditation? What burning questions or topics do you want me to add to the list? We're definitely going to do one on what's called genital urinary symptoms in menopause. That's sort of what's in that bucket. Increased risk of urinary tract infections, vaginal dryness, which can lead to some painful intercourse, so it can change our desire, our libido. So there's a doc that has reached out to me who wants to help with that. So that's coming. We're going to do that one in the collective. This is this private online community, because I think it's a sensitive topic, and I think we will be able to have a better conversation in a place where it's private. So that one for sure we're going to have over there. I'm just working out the timing and the date for that. So that'll get published. And again, that'll be in the collective, which people can join. If you want to be added, I can do that. Right now, I'm letting people in for free. Somewhere around February, I'll open it up, and it'll be a nominal fee, a monthly fee to join. But for now, I'm opening it up if anybody wants to join for free, just to sort of start the conversation and get everybody comfortable in there. So that one for sure we'll do in the collective. But as far as the lives, oh, gotcha. Okay. I think I posted that one on Instagram, the hair loss one. So that should be on my feed, I think. I'll double check, but I think that one should be on my feed. And then I usually will move those into the collective as well. So once I do these here, they should post on my feed, and then I put a copy of it in the collective. So all of them should be there as well, where you can rewatch them there. We can start conversation. I mean, the idea with the collective is, where do we go after Thursday at 10 o'clock? And that's my hope for that space, right? It's a place where I'm in there. So if there's questions that you have of me as a doc, what am I seeing? I'm happy to answer those questions. I love people to, share what they're doing. What are their tips? How are they keeping themselves healthy? It's a place to continue this community beyond Thursdays at 10 o'clock. So I've got some things in there that I post, but I would love people to be in there with me and just having an open place to dialogue, and then we'll have some of these more sensitive kind of conversations in the collective as well. We actually did a supper club. I really like Sweet Potato Soul, the website, and I think her name is Janae, I think is how she pronounces her first name. She's an African-American vegan chef and has quite a few cookbooks out. So she had a cold soba noodle recipe with king oyster mushroom scallops. It was delicious. So that's what I cooked, and we had supper club last Monday evening. So that was in the collective as well. There's book club in there. So I think we're doing some cool things. So I would love to have more people in there. So hopefully I'll see you on that side. And then again, topics, send me a private message, or, however, just communicate with me what would be helpful. Otherwise, I'll just keep sort of trucking down my list of topics that I know that people ask me about. And that's usually where I get it. Somebody asks me a question, and that's what I talk about. Okay. Well, thank you. You guys have filled my cup today. If there are no other questions, I'll see you guys next Thursday at 10 a.m. Pacific time. Share with other folks if you don't mind. Anybody you think would be interested. I'll post the link to get the sleep, my little tidbits on how to get good sleep, at least some tips around that. And if there's anything else, shoot me a message. Alrighty? Have a fantastic day, everybody. I appreciate you. Goodbye. Thank you for joining. Bye-bye.